Good evening and thank you for joining us. I'm Riley McManus. Thousands of nurses and other frontline healthcare workers were protesting across Ontario today to show their opposition to Bill-124. The bill limits wage increases for public employees, including nurses. Here in Thunder Bay, a large crowd of union members gathered to march in support of better compensation and better care for frontline workers. Mike Lang reports.
There are 490 plus nurses working, about 300 sleeping, and we're what's left. Let's go!
The cost of living has substantially increased, but wages for nurses have not. 3 years ago, Bill-124 was implemented by the Ford government, stating that the compensation for workers in the public sector, such as nurses, should only increase based on the fiscal situation of the province. However, frontline workers feel that the bill has created more of a fixed ceiling to their salaries instead of allowing them to increase correspondingly with the cost of living. With the Ontario Nurses Association and the province in the midst of contract negotiations, close to 100 local nurses and other healthcare workers flooded the streets around Thunder Bay Regional to support the ONA and voice their opposition to Bill 124.
We want better wages for nurses. It's been a decade at least that we've been wage suppressed, and we need better staffing. We need workloads that are reasonable so we can provide patient care. And in that, we want better care for Ontarians.
The lack of wage increases and heightened workload for frontline workers during the pandemic has caused many to resign and little incentive for those looking to become nurses. The ONA says this has led to the doubling of nurse-to-patient ratios over the past year, as practitioners feel that they are being overworked and thus unable to provide a consistently safe and quality level of care to patients.
We need help, and this is our profession, and we're going to work, and we're asking to look after double, triple workloads, short-staffed every single day, 12-hour shifts, 16-hour shifts over and over again. We can't take it anymore. Our healthcare system is failing, and we're the backbone of that system, and we need help, and no one is listening. And so we're out here today protesting and picketing to show the community that it's not okay. Something is wrong, and we need help.
Patient care is suffering in our hospital. We have so many extra patient loads, triple, quadruple. That's like 13 patients for one nurse, and that is not safe, and we need to change that. It needs to change. Nurses are burning out, and we can't do it anymore.
The current contract for members of the ONA is set to expire at the end of March, with mediation scheduled for next week. Mike Lang, TBT News.